Congratulations on your pregnancy. This is a momentous journey you're about to embark on. This is such an exciting time, filled with anticipation and joy, and let's be honest, a few worries too. It's natural to have questions and concerns. One common concern many expectant mothers have is fever. It can be unsettling when your body temperature rises. Is it normal? When should you be worried? These are important questions to consider. It's perfectly understandable to be concerned about fever, especially when you're carrying precious cargo. Your baby's health is your top priority. Your body is going through so many changes, and sometimes a fever is just a sign that your immune system is working hard to protect you and your baby. However, there are times when a fever during pregnancy needs a doctor's attention. It's crucial to know when to seek medical advice. This guide will help you understand the ins and outs of fever during pregnancy, empowering you to make informed decisions about your health and the health of your little one. You'll learn what to watch for and how to respond. Remember, knowledge is power. Let's dive in and explore everything you need to know to keep you and your baby safe and healthy. Before we delve into pregnancy-specific fever triggers, let's quickly recap why we get fevers in the first place. Think of a fever as your body's way of fighting off unwelcome invaders, like those pesky viruses and bacteria. Your body's internal thermostat, located in your brain, usually sets your temperature around 98.6 degrees Fahrenheit, or 37 degrees Celsius. When you get an infection, your immune system kicks into gear, releasing chemicals that tell your thermostat to crank up the heat. This rise in temperature makes your body less hospitable to the invaders, while simultaneously giving your immune system a boost to fight them off more effectively. Pretty clever, right? The first trimester is a time of incredible transformation, a period where your body undergoes significant changes to support the new life growing inside you. As your body works tirelessly to build a cozy nest for your little bean, you might find yourself feeling more tired than usual. It's also a time when your immune system is naturally a bit weaker, making you more susceptible to those pesky colds and flus going around. This is your body's way of ensuring that your baby is protected, but it can leave you feeling under the weather. So, what are the usual suspects behind a first trimester fever? Let's take a closer look at the common culprits. The most common culprits are the same ones that plague the non-pregnant population, but they can feel more intense during pregnancy. The common cold. The sniffles, the sneezes, the general feeling of yuckiness. The common cold is a frequent flyer during pregnancy, often bringing a mild fever along for the ride. While it might just be a minor inconvenience, it's important to take care of yourself and get plenty of rest. The flu. The flu can really knock you off your feet, causing fever, chills, muscle aches, and fatigue. It's more severe than a common cold and can make you feel quite miserable. It's important to contact your doctor if you suspect you have the flu, as they can provide guidance on how to manage your symptoms safely. Urinary tract infections, UTIs. UTIs are more common during pregnancy due to hormonal changes. They can cause fever, pain, or burning during urination, and a frequent urge to pee. If left untreated, UTIs can lead to more serious complications, so it's crucial to seek medical advice if you experience these symptoms. Remember, even if your fever seems mild, it's always best to check in with your healthcare provider, especially during the first trimester. They can help ensure both you and your baby stay healthy and safe. By the second trimester, you're likely feeling more energetic and vibrant, ready to take on the world. Your baby bump is starting to make a grand appearance, becoming more noticeable each day. Your immune system has also bounced back somewhat, making you less vulnerable to those common bugs and colds. However, there are still a few reasons why you might experience fever in the second trimester. Occasionally, certain medications can cause a drug-induced fever, which might be unexpected. If you experience a fever during your second trimester, it's always a good idea to contact your doctor to rule out anything serious and ensure your health and your baby's well-being. As you approach the finish line of your pregnancy journey, your body is working overtime to prepare for labour and delivery. While most fevers in the third trimester are caused by the usual suspects, colds, flu, stomach bugs, there are a few additional things to keep in mind. This is a rare but serious infection of the amniotic fluid and membranes surrounding the baby. It can cause fever, chills, abdominal pain, and a foul-smelling vaginal discharge. While fever itself doesn't cause preterm labour, it can be a sign of an underlying infection that could lead to preterm labour. It's crucial to contact your doctor immediately if you have a fever in the third trimester, especially if it's accompanied by other symptoms. Now that we've covered the common causes of fever during each trimester, let's talk about when a fever should send up a red flag. Contact your doctor right away if your fever is high. Generally, a fever of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher warrants a call to your doctor. Also, if the fever is persistent, meaning it lasts for more than 24 hours, even if it's low grade, it needs to be checked out. Be extra vigilant if your fever is accompanied by other symptoms like a severe headache, stiff neck, rash, difficulty breathing, abdominal pain, or confusion. Remember, it's always better to err on the side of caution when it comes to your health and the health of your baby. Don't hesitate to contact your doctor if you experience a fever during pregnancy, especially if you're unsure about the cause of your fever. You have other symptoms along with the fever. Your fever is high or persistent, or you have any concerns whatsoever. Your doctor is your partner in this journey and is there to help you navigate any bumps along the way. Dealing with a fever is no fun, especially when you're pregnant. Here are some practical tips to help you feel better faster. Rest up. Give your body the energy it needs to fight off the infection by getting plenty of rest. Stay hydrated. Fever can lead to dehydration, so drink plenty of fluids like water, clear broth, or electrolyte drinks. Cool down. A lukewarm bath or cool compresses can help bring down your temperature, and ask about medication. Your doctor can advise you on safe medications to reduce fever discomfort. Pregnancy can be a roller coaster of emotions, and worrying about fever is completely normal. Remember, knowledge is power, and by understanding the common causes of fever during pregnancy, you can approach this aspect of your journey with confidence. Always trust your instincts and don't hesitate to contact your healthcare provider if you have any concerns at all. You've got this, Mama.